Talking about prosthesis, it is the external applied device which replaces a body part. This can be cosmetic or functional, as the composition can be divided into socket, suspension, pylon, articulating device, and terminal device. Socket is the interface between the prosthesis and a residuum. It may have negative pressure socket or a locking liner. Regarding suspension, it explains how it holds on to it. Now, it can have a cuff that tightens like a cuff around the knee or the residual. It is reliable, but there is pistoning. Then there is a liner or a supracondylar type that is suspension device and relies on flexibility of the material to pinch in and hold on. The pylon is a part between the suspension and the articulating device. Then comes the articulating device that can be knee or the ankle. Regarding the knee, it can be locked or free. The locked can be hand operated locked or semi-automatic locked. That is Hokel and Sackel. Or it can be free, which can be unicenter, polycenter, and might have microprocessor unit to control the knee. Then comes the terminal device. We have the foot as a terminal device. It can be solid ankle cushion heel, which is only one rocker. It can be multi-flex, that is forward, backward, and side to side movement. It can be an adjustable heel, or it can be energy conservative like carbon fiber, which has more dynamic movements. Regarding the upper limb, it can be for cosmesis or functional. In functional, it can be body powered or myoelectric. It has body powered has straps which activates it so that the body movement, the strap moves and it activates the function. Or a myoelectric, which has sensors at the muscle, which helps it to move when the electrical stimulus is reached. Regarding another classification, the structure can be exoskeleton or endoskeleton. Exoskeleton is rigid outer shell with hollow prosthesis. Endoskeleton is modular. There is internal strut which covers in soft external cosmesis. Regarding a good stump, you should talk about length, soft tissue and scar, bone cuts, and neurovascular structures. Regarding the length, 3 rules. It should be 12 to 18 centimeter from the medial joint. It should have 1 inch per feet height. 2/3, 1/3 rule. 1/3 of the tibial length and 2/3 of femoral length. Regarding soft tissue, it should be good healing, no tension, bony ends covered adequately, either myoplasty or myodesis. Bone cuts, it should be beveled. The fibula should be 1 to 2 to 3 centimeter above. Regarding neurovascular structures, hemostasis, and the cut nerve should be high as possible to prevent neuroma formation. Complications of amputation, stump, skin problems, phantom limb, pain, choke syndrome, high energy requirement. Regarding the energy requirement, Siamese needs 15% above the baseline, long below knee 10%, short below knee 40%, average below knee 25%, bilateral below knee 20 to 40%, unilateral above knee 60%, bilateral above knee 200%, and hip disarticulation above knee bilateral 200% and hip disarticulation 200%.